Thank you very much. We're honored by your presence. And this is a very interesting theme to me, very close to my heart, because we have been trying to get the oncological community to fight cancer with the patient's immune system. We've been doing immunotherapy here for over 5 decades in many, many forms, from the most simple ones like laughter therapy, for instance, has been proven to improve the quality and quantity of the immune system. Meditation, music, even colors can affect the mood of your immune system. And we have been exploiting this in the good sense of the word for the benefit of our patients with cancer, especially when they're in stage 4. But lately, and I think this is already revolutionizing the way we are treating patients with advanced cancers in the world with the dendritic cell vaccine and some variations of it, and we'll talk about it. And also, we've been using hyperthermia for now probably 3, maybe close to 4 decades here. And so let me talk a little bit first about the principles of hyperthermia. This was noticed first in the late 19th century in Vienna by an oncologist that treating cancer patients noticed that patients that got infected severely, if they survived the severe infection, they actually did better or fared better with their cancers, and some of them even got remissions. And he came to the conclusion that this fever was caused by an immune reaction, and that the immune reaction had a direct effect against the tumors. And so when he noticed this and he published this, some of his colleagues, and then in New York, they started doing what was called at that time fever therapy. And they were provoking therapy by actually infecting patients. Now, this is very dangerous in a cancer patient because they're already immune suppressed, and a major infection can trigger many organs to fail and then can actually cause death. And so they came up with a combination of bacteria that would be a mild infection and then produce fever. Later on, we actually found the mode of action on how temperature can affect tumor tissue. And the reason for this is that tumors grow very rapidly and unorganized, in an unorganized form, in comparison to normal tissue that is very well organized, and by that, all the cells are very well formed, and especially the vasculature, the lymphatics, the veins, and the arteries are very well organized. And in fact, our circulatory system works as a radiator to disperse heat from our body. And so normal tissue, if you heat up when you develop fever, has a very good method of getting rid of the extra temperature, and that protects the tissues. Whereas malignant tumors, because they're so convoluted and their vasculature system is also very poorly organized, they cannot get rid of heat as well as normal tissue, and the cells can actually suffer to the point of dying because they keep the temperature in comparison to the normal tissue. So when you increase the temperature significantly of a patient, the normal tissue can withstand that temperature, whereas malignant tissue cannot. And this is the mode of action of hyperthermia to kill cancer cells. Now, in order to do that, you have to increase the temperature above 41 and a half, even up to 42 degrees Celsius. That is a very high temperature that normal tissue can withstand. but malignant tissue cannot. So it has a direct anti-tumor effect. But in order to be really effective, you have to keep that temperature for a very long time. And this is not necessarily easy. In fact, it's quite difficult. And we have been modifying the use of hyperthermia here at the Oasis of Hope Hospital, where we use hyperthermia as an adjuvant to other therapies. That is, we're not relying completely on the cancer-killing capacity of hyperthermia, but we use hyperthermia to make the malignant cells more liable. And that way, other therapies can be more effective and provoke less side effects. So hyperthermia has a direct anti-tumor effect, but it's also proven to have a direct impact on the immune system. So it increases the capacity of the immune system. It helps detoxify the body. And also it increases the oxidative stress. And so one of the main therapies that we use to kill cancer here is with oxidative therapies, one of which is the use of high dose of vitamin C. So it has a very synergistic effect with vitamin C and other therapies to kill cancer cells so that we don't have to prolong the time of hyperthermia to our patients. But it also provokes what is called heat shock proteins. And these proteins are triggering to the immune system. So it wakes up the immune system. So in combination with immunotherapy, like the dendritic cell vaccine, has proven, and there are a number of articles published, that it has a synergistic effect with the immune system when you use immunotherapy. As I mentioned to you at the beginning, I'm excited that immunotherapy is really coming now to the forefront in the treatment of cancer, and more immunotherapies are being developed in America, especially what are called checkpoint inhibitors. And this, what it means is that the immune system is very regulated, and these therapies regulate the immune system so that the immune system can be more forceful in attacking the tumor. And whenever possible, when we can combine the dendritic cell vaccine with these conventional checkpoint inhibitors, the results can be very good. The disadvantage, especially for countries like ours, is that these targeted immunotherapies are extremely expensive, and they're out of reach for most of our Mexican patients, even for American patients, because when they use it in combination with alternative therapies, the insurance company will not pay for those therapies that, as mentioned, are very, very expensive. So when we say that hyperthermia and immunotherapy are revolutionizing the way we treat cancer patients, not only that, it is really a revolutionary way to help patients fight their tumors, but they are very effective. We are having very wonderful results in patients with therapies that are virtually non-toxic and well tolerated. There are some patients that are not candidates for hyperthermia, and later on, Dr. Julio will explain to you what those cases are, where a patient is just not a good candidate, and then we couldn't use them. And in those cases, we use the vaccine without the hyperthermia. So hopefully this information has brought you some clarity, and I know that after this, you'll probably have more questions about how we use hyperthermia and immunotherapy in our hospital. And so we'll go right into the questions. We have questions that are being posted live, and we have some questions that were submitted before we started this, when we sent the invitation. So Gaston is going to help us be the host of the question and answer period.
I'll be the moderator. Thank you so much. Please, thank you so much, Dr. Contreras, for that insightful introduction to hyperthermia and immunotherapy. We're gonna begin the Q&A portion of this webinar. Please feel free to ask your questions in the Q&A chat or in the chat box, and we'll be switching from live questions to pre-submitted questions. And just before we begin, give you guys a chance to ask your questions. If anybody has any questions about how to become a patient here at Oasis of Hope, or speak to one of our doctors about your diagnosis and or recommended protocol, please feel free to call us at 888-500-4673. That's 888-500-4673. And or email us at info@oasisofhope.com, or you can go on our website and fill out one of our contact forms or our medical questionnaires, and one of our admissions coordinators will get to you as quickly as possible. So we have some submitted questions. We'll start off with the pre-submitted questions, so we can give you a chance to ask your questions, okay? Marilyn is asking, does hyperthermia and immunotherapy treat bone cancer as well?
Yes, it will treat any type of tumor, no matter where it is. The mode of action is the same. And so bone metastases are very common, especially in breast cancer, in lung cancer, in prostatic cancer. And this combination therapy has proven to be very effective against bone metastases.
There's a lot of questions also on breast cancer. Is it similar answer, or is it different? Does it differentiate?
Well, there are many types of cancers of the breast, but they all have some common denominating factors that are metabolic. And so that part of the therapy will be very effective. The immune therapy is extremely personalized, okay? But the hyperthermia can be used for all types of breast cancer, triple negative, hormone dependent, lobular or ductal. It doesn't matter. We can use the hyperthermia and the immunotherapy for both of them.
Perfect. I mean, Troy here has a good question. It's a long question. I'll read it out. Hi there. I'm from Regina, Saskatchewan. I was diagnosed with terminal cancer, melanoma, at age of 42. My oncologist said I had 6 months to live. I'll be 44 in a few weeks. The immunotherapy is working, I believe. I had 28 tumors inside me and 2 on my brain. Last scans and MRI showed they were gone as of mid-September. What would you think my life expectancy will be doing immunotherapy every 2 weeks? Thank you.
Immunotherapy, as mentioned, has proven to be very effective, especially in melanomas. And I'm sure that you have the combination of Opdivo and Yervoy. And so we're very happy with hearing about your results. And so the mindset of oncologists is that they're going to be able to help you only for a while until these immunotherapies work. I would urge you, now that you have good results, to come, because with the dendritic cell vaccine, we can probably consolidate those excellent results so that you may have a long life expectancy. And so one of the things that you have to, I think, fight against is that type of information where they're only prolonging your life for a few months. No, you have good possibilities because of this very good response to live a long life. And I think that consolidating with our immunotherapy and the rest of our therapies, that you can have a very long life. You're very young, and I think that no stone should be unturned.
Perfect, perfect. Troy, thank you so much for that great question. We're going to go to pre-submitted questions. We have over 300 pre-submitted questions, and a lot of them have to do with differences between sauna and hyperthermia. And I've been reading the questions and also different types of hyperthermia. Could you go into a little bit about sauna, Heckle machines, full body hyperthermia, and how Oasis actually does a hyperthermia different from any other centers?
Yes, I just want to let you know that there are a number of methods, and I would like Dr. Julio to talk about the methods that we have here and some of the other methods. And if I have any other comment, I will share it with you as well.
There is a major difference between a sauna and a hyperthermia. Okay, normally saunas have a temperature that ranges between 150 to 165, 170 degrees Fahrenheit at the most. And here we use a hyperthermia which increases up to 194 degrees. So that's the first major difference between a sauna and the hyperthermia. Secondly, if we want to have an effective hyperthermia that's going to be working against cancer and helping your immune system fight against cancer, we need to get you in the hyperthermia for at least an hour in order to get your body temperature to a range of between 104 to 107 degrees Fahrenheit. That it's not something that you can achieve by going into a sauna. The main benefits for the regular sauna would be wellness. It would be improving your circulation, making you feel better, but not against cancer in that range. You have to do actual hyperthermia under medical supervision in order to have that benefit. Now, there are several modes, there are several modalities of hyperthermia. There's the whole body hyperthermia, which is the one that we practice here. There's a localized hyperthermia and a regional hyperthermia. There's also something called a HIPEC, in which you put heated chemotherapy inside the abdominal cavity after a surgery. Here, we mainly do whole body hyperthermia, which is proven to be the most effective for patients with metastatic cancer. Okay, so that's.
Let me just mention also about the difference in sauna. So our body has a regulating system for temperature. And sauna is not able to break that regulatory system. And that's why the temperature will never go above 39 degrees Celsius, which is what in Fahrenheit?
104, 103, 104.
103. So, so our regulatory system will keep that.
Yeah.
These hyperthermia machines have a system that helps break that barrier, and that's why the temperature can go high. And for that reason, Dr. Julio here is with the patients at that time, all during the process, because it's a temperature for which our body was not designed to live with. And so we have to just make sure that the patient is able to tolerate that the heart function is okay, that the kidneys are okay. And so it's not an easy thing to do. Also, with regional and local hyperthermia, you can get some anti-tumor effect. There's no question about it. But the systemic effects of immune stimulation, of detoxification, and of oxidative stress can only be achieved with whole body temperature, whole body hyperthermia. And that's why we choose at the Oasis to only do the whole body hyperthermia.
Great answer, great answer. We're gonna go with the live question. Troy, let's see, have you had any success with retroperitoneal liposarcomas?
Yes, and I'm happy to say that because of since the advent of the dendritic cell vaccine, we have now started accepting patients with sarcomas. For the longest time, sarcomas were not responsive to our normal or typical alternative therapies, and for that reason, we were not treating them. Because of the vaccine, we started trying a few patients with sarcomas to see if the vaccine would have a better effect. And to our surprise, they are very responsive to immunotherapy. And so, yes, we no matter where if it's a liposarcoma, if it's a osteosarcoma, if it's soft tissue sarcomas, whether they're in the retroperitoneum or in the muscles or in the bones, we have been using very effectively our dendritic cell vaccine in combination with all of the other therapies as well, because as I mentioned to you, some of our therapies will not be effective in reducing tumor mass on their own, but in combination, we have a much better possibility of helping cancer patients when we say bunch up against the tumor. But especially in sarcomas that are very difficult to treat, we will use vitamin C, vitamin B17, hyperthermia, ozone therapy to make the tumors more liable, the tumor cells more liable, and then the immunotherapy can be a lot more effective. So the combination has proven to be now quite effective. And to answer your question, yes, we have been successful in treating liposarcomas of the retroperitoneum here at the Oasis of Hope.
Perfect. Perfect. We're gonna go with another live question. Keep your questions coming. They're great. We will get to you. We will get to you. Paula Aguilar, hypothermia is hypothermia okay for me? I suffer from lymphedema.
Yes, I don't think that's I'm assuming that you had a mastectomy and you have lymphedema because of the mastectomy, or for any other reason, radiation therapy sometimes can cause that. And yes, that is not a contraindication for hyperthermia.
Perfect. We're gonna go with the
Do
pre-submitted.
you want to add
No,
anything to that?
it's fine.
So we go with a pre-submitted question from David from Indiana. Stage 4 prostate cancer with mets to lymph nodes. Recommendations.
We have been very successful in treating all sorts of prostate carcinoma with lymph node metastases or even bone metastases. The cancer can be more aggressive or less aggressive. So the higher the Gleason score, and this is a score that determines how aggressive a tumor is and goes from 6 to 10. Obviously, the more complicated the case will be. But even in Gleason score 10, we have been very successful in treating prostate carcinoma with lymph node metastases. They have still a better prognosis than when there is bone metastases. But even when there's bone metastases, we have been able to treat. And maybe you can talk a little bit about the benefit of hyperthermia as far as pain control.
Yeah, actually, hyperthermia is also used in issues like fibromyalgia in order to control pain, and we have major benefits, especially with the combination. In this case, hyperthermia is going to be an adjuvant, for example, to vitamin C and B17 in order to help achieve pain management. Here, we're treating patients who normally are taking major amounts of opioids, and we are able to control the amount of opioids that the patients are taking by giving a combination of treatments like I'm telling you.
And I mentioned that because one of the major issues of patients with cancer of the prostate is pain. When there's lymph node metastasis only, the pain is not such a major issue. But the most of the patients with prostate cancer develop bone metastases, which are extremely painful. And so the hyperthermia is not only very good to help the patients reduce tumor activity, but also to control pain.
Excellent. We're gonna go with another live questions. A lot of questions coming in. Thank you so much. Can hypothermia be done partially, or must it be done on the entire body? I think you kind of went through this, right? Yeah. I know
Yeah, just to reiterate, there's no question that regional or local hyperthermia will have some anti-tumor effect and some immune effect, but one of the two main reasons why we use hyperthermia here is oxidative stress and also anti-tumor effect, which will be achieved much better with in the immune stimulation which will be more affected by whole body therapy than just regional therapy.
Let me ask you a quick question. In the centers where they do local hyperthermia, per se the Heckle machine, post-treatment, that doesn't boost the immune system, it just kind of potentiates the effects of the treatment locally?
It doesn't actually potentiate much more the other therapies.
Okay.
The aim with local hyperthermia is to kill tumor tissue.
Okay, got it.
Ablation.
Got it.
The ablation.
Okay, got it. Okay, I think that was All right, this is a good question. How do you determine how many hyperthermia treatments a patient receives? That's a good one.
I will let Dr. Julio talk about that, but I just want to say that hyperthermia is a therapy that stresses the circulatory system significantly. And so Dr. Julio evaluates the patients to determine how good of a candidate it is to even to begin the therapy or not, and how many treatments can we give.
Yes. Once you get the first hyperthermia, you're gonna realize it's not something that you can do every day. The
Yes.
hyperthermia has to be done at least with a 4 days to 7 days rest in between each one. And since the hyperthermia is helping something else, it has to be done in combination with something. For example, the vitamin C or the vaccines, the immunotherapy that we use here. So that's gonna be the main limitation for the amount or the frequency of hyperthermias that we can do.
So think about this: when you go into the hyperthermia machine, and you're there for about an hour, it's puts so much stress on your circulatory system, akin to probably running 5 miles. And so even patients that are in very good shape,
Yeah.
are not able to run 5 miles every day.
I would say 5 miles in Colorado.
At high altitude.
Right.
So most patients in stage 4 or advanced cancers would not be able to do more than one therapy a week, or maybe a couple of weeks.
Sounds good, sounds good. We're gonna go with more live questions, which are amazing. Good question. What
Mhm.
procedures are included in immunotherapy? Immunotherapy is such a broad term. Now,
That's
Yeah.
very
it's kind
true.
of like alternative kind of treatments. They're so broad, but the way we do immunotherapy, I'll let you continue.
So I mentioned to you that there's many ways to improve the quality of your immune system, laughter, for instance. So we will go from the most basic, just being happy will stimulate your immune system. There's a study that shows that for 1 minute of anger, your immune system will be depressed significantly for a period of 6 hours. And for every minute of laughter, it will improve significantly for a period of 24 hours. So there are many things that you can do to improve the quality of your immune system. Then we have supplements, for instance, or some products that directly impact the immune system. Melatonin, for instance, is a very potent immune stimulating agent, and we use many agents like this to improve the quality of your immune system. And then we have direct immune therapies, like the checkpoint inhibitors that I mentioned to you, but especially the dendritic cell vaccine. And there are some variations of the dendritic cell vaccine that we can use depending on the quality of tissue that we have. So most of the vaccines are prepared from tumor circulating cells. Those are tumor cells that we find in your blood when we draw the blood. But we can obtain malignant cells from tumors, fresh tumors, or old tumors, tumors that are kept in paraffin blocks. Then we can obtain direct dendritic cells that we can activate with antigens from the tumor, or we can obtain from tumor tissue what are called the antigens of the tumor. And the antigens on their own can produce immune stimulation without the dendritic cells. And the most extreme is when we find tumor infiltrating lymphocytes. Those are the lymphocytes that were able to get into the tumor. When we remove tumor tissue and we obtain those, and we can culture those, that's a very potent form of immune therapy that can be used with or without dendritic cells. So there's many variations, and I'm just mentioning the most well studied, and there are more. And so we have improved our immune therapy over the years, and it depends on two things: the research and the capability of our very sophisticated lab to be able to produce these elements. which can only be done by very, very specialized personnel and in a very specialized laboratory.
Well said. Yeah, immunotherapy is what's really changing things.
Yes,
Changing things,
it has a tremendous fan of opportunities, and we're very excited because we are increasing the number of elements that we can use to stimulate and activate the immune system of a patient directly against, I mean, specifically against their tumors.
That's amazing. That's amazing. Yes, we've been seeing a lot of patients come for immunotherapy in terms of the TILs, the tumor-infiltrating lymphocytes or the dendritic cells. Some patients bring the paraffin blocks, where you actually get the actual antigen from the paraffin block. So it all depends on the type of cancer stage. And but I'm very excited about extracting the tumor tissue from the actual tumor in a biopsy form and creating the TIL. So we'll continue to have more information on you because it's constantly evolving.
Yes.
Finding new information every day and treating patients. So the great thing about Oasis is that we're at the forefront
Yes.
for all these immunotherapies, and we're actually treating stage patients at some in early stage, but many in late stage cancer.
Yes.
We're seeing amazing results. So let's continue. Let me see. Okay, Annery, very specific question. Immunotherapy works for triple negative that had mutated to a cancer with hormones receptors. Now stage 4 affecting lymph nodes removed already and bone metastasis. I imagine she's saying triple negative breast cancer.
Stage 4.
Stage 4.
Yes.
Hormone receptor.
Now, this is a very interesting case, Amory?
Annery.
Anery. Because normally the mutations are from complicated to more complicated, or from malignant to more malignant. And a triple negative is usually one of the most aggressive breast cancers there are. And if yours mutated from triple negative to hormone dependent, that's a blessing. That's very good for you. Your prognosis just by that has improved because now we have more elements, more tools to treat your cancer. And in spite of the fact that you have bone and lymph node metastases, the possibilities for you are very good. I would urge you to go into our page and look at our stats in stage 4 breast carcinomas, and they're very impressive. They're between 3 and 5 times better than with conventional therapy alone. So you would be a very good candidate for our therapy.
Thank you, Annery. If you have any questions, please feel free to call us or go onto our website and fill out one of our contact forms. I'm going to get to Sally. She's had a question for a while now. Hi, Sally here from Australia. Hello, Sally. Can I ask, are any of these therapies able to work on blood cancers, namely myeloproliferative neoplasm, where there isn't really a traditional tumor to target? Thank you.
Yes, MDS, very good question, because until about 6 months ago, we were not able to use dendritic cell vaccines for circulating tumors. But the technology has improved to the point that our immunologists feel that we can treat now circulating tumors with this, with a caveat. These are tumors that are growing very fast, and they're too fast for a natural therapy alone. And so in those cases, what we normally recommend, because they do respond very well to conventional chemo, is to do the chemo first, reduce the tumor activity or go into a complete remission, and then the consolidation with our therapy and the immune therapy can be more effective to prolong the periods of remission and hopefully to consolidate a cure. So the possibility for MDS to be cured is there, but to date, we are doing a combination therapy where we use conventional therapy first, and we consolidate with our therapies once the most or the best results that you get with conventional therapy. from less tumor activity to complete remission.
Great question, great question. We're gonna go with another live question because we have so many, and you guys are live, so please submit your questions. If you have one, get it live. I haven't found a hyperthermia location here in California in my area where I live. How about doing saunas with infrared light? Or do you have any recommendations where I can purchase it until if I can purchase it?
That I know of, there are no machines, right, available to the public.
Saunas, no, well,
Saunas, yes,
hyperthermias,
and sauna with
Yeah.
wet, but as we mentioned before, a sauna will not break that barrier to get the temperature above 41 degrees. And so while it's good for you, it is immune stimulating, it is detoxifying, it does not have a direct anti-tumor effect, and it does not have the oxidative stress for which we mostly use our treatment here. And again, I don't know that there are any machines available, like the ones we have, for instance, available to the public. And then you would need an expert
Medical
like Dr.
supervision.
Julio in medical supervision during the whole process. So I don't recommend it like when those advertisings that they have that they have on TV, like a crazy guy driving, and they put we
Yeah,
do not
no.
recommend this for you to
I
do.
think
Yes.
most commercial saunas have mechanisms to stop the sauna from getting so high. So they stop on its own after 40 minutes, half an hour, and it's never gonna get to that degree.
Yeah, it's kind of like the ozone therapy with hyperbaric. Because if you also you have to create oxygenation within
Within
the
the
tumor
tumor.
cell,
Yes.
and
Yeah.
hyperbaric oxygen doesn't achieve that.
Well,
As effective-
hyperbaric chambers will achieve the at least the concentration of
concentration,
oxygen
okay.
within the tumor, and that's really good.
Okay.
Ozone
How many
is a little
atmospheres
bit.
do you have to go down? How many atmospheres?
I
do you
think
have to
it's
About 3 or 4?
between 3 and a little bit
do? A little bit higher?
higher.
Okay, got it.
And so the typical home hyperbaric,
The one you zip up.
those
That-
are about two and a half.
2.5. Okay, got it. It's a great question. We're gonna go with Georgiane Dowes, and she's got a really specific question. Stage 4B ovarian cancer, have had chemo, debulking, and additional chemo. Now getting Zerbev every 21 days and functional medicine protocol through Dr. Yu in Missouri. Would hyperthermia be helpful?
Yes, and maybe your doctor has the capability of doing hyperthermia there, but in that case, yes. And the immune therapy would also be very helpful for you.
Perfect. Let's move on to anonymous, no name. Can hyperthermia be or should be used with stage 4 melanoma diagnosis? Who is in immunotherapy? Is there a benefit or should I just stick with immunotherapy? Thank you.
The immunotherapy is the main therapy for you, and it has proven to be quite effective. If you can combine it with hyperthermia, it would be very, very good. But I would do the immunotherapy until you're in complete remission. And again, if after that you want to come to consolidate and prolong the periods of remission, it would be good for you. But the main therapy is immunotherapy.
Here's a great question from Olivia. Can I still do hyperthermia if I already have a port inserted under my clavicle bone?
Yes, there's no contraindication. for
We've
that.
done hyperthermias with port, we've done hyperthermias with implants, we've done hyperthermias with PICC line catheters, with central catheters. There's no issue. The only limitation I would do if you have a pacemaker. That would be the only thing.
Got it. Marjo is asking, do you ever treat meningiomas?
Well, we've treated meningiomas, but we don't have any stats because they're so rare, at least in our community of patients. So I wouldn't be able to give you a lot of information about meningiomas. In general, benign tumors do not respond very well to alternative therapies because the tissues are so aligned with normal tissues that a therapy is not very normally for benign tumors is not effective, and meningiomas generally are benign tumors.
Perfect. We're gonna take a small little break and just let you know about Dr. Contreras' book, The Art of Undermining Cancer. It was written about a year ago, and it's a great explanation, very, very easy to understand. Topics about our treatments, how we do our philosophy here at Oasis of Hope, our total care approach, where we combine body, mind, spirits. And today we are giving away about 10 of these signed books. So you'll probably get an email from us if you get chosen. Just send us your address and we'll send you a free signed book from Dr. Contreras. And all right, moving
But
on.
if you are not lucky to get the signed copy, you can download
Yes,
it
yeah.
from our page, okay?
Thank
Free.
you for reminding me, Dr. Contreras. You can go on our website and you can download a free copy if you want to read it today. So feel free to do so. Let me see. Moving on. A lot of questions. How about Catherine? How do you take melatonin to boost your immune system?
Well, melatonin, even in low dosages, will improve your immune system. We use very high dosages of melatonin, between 30 and 50 milligrams, orally every day. So depending on what effect it has on you, usually the patients will take it at night so that they will sleep better. And not only will it have an impact on your immune system, powerful effect on the immune system, positive impact, but it also has a mild anti-tumor effect as well, especially in breast cancer. So melatonin is one of the elements that we recommend to all of our patients at the Oasis.
Perfect. This is a question from Anonymous. Do you review and make decisions for patients for what treatments, or does he or she need to be at your center so the doctors can make a recommendation?
Usually what we request is for you to send us sufficient information for us to make a recommendation. You don't have to be here. So in general, I can tell you, yes, our treatment would be of benefit to you or not. And if it's, and depending on your condition, we will let you know if you're a good candidate to come or not. So you don't have to be here for us to make the evaluation.
Perfect. Okay. Troy, what is the typical length of time needed to stay for treatment at your clinic? And are follow-ups done case by case?
Yes, the average stay is about 14 days. There are some patients that will need maybe 20, 21 days, depending on the protocol that they will go into, depending what type of immunotherapy they will have. But so the average is about 3 weeks, but there are some patients that will stay 2 weeks. And then we have some patients that have to stay longer because of complicated cases. But I would say the average is about 3 weeks.
Perfect, perfect. And moving on to Catherine. HR and ER negative, HER positive breast cancer metastasized to scalp. Will this form a treatment help, both papillary and ductal?
Yes, in both cases, regardless of where the metastasis is. Skin metastases from breast carcinoma to the scalp are very rare. I'm not sure if you're talking about the scalp or the actual bones in your brain and in your head, the skull. But either way, the treatment can be very effective for ductal and for lobular cancer.
Perfect, perfect.
Hormone dependent or not, in your case, it's not hormone dependent, but it's HER2 positive. So in many cases, we do not have to use the anti-HER2 treatments, especially if it's only metastasized to the scalp. Most likely, the treatment on its own, without the aid of anti-HER2 products, will be effective.
Perfect. And Troy says, I want one book, please.
Troy,
I remember you, Troy. I will make sure you get assigned. Send us you'll get an email from me. So you can send me your address and we'll personalize it for you. Let's get Dr. Julio involved a little bit. On Gabriela, on a very early stage of prostate cancer, would you recommend to remove the prostate and then move over with over any other alternative treatments, or is it better to start off with alternative treatments? So surgery, treatments, or treatments first?
I would say the treatments, the alternative treatments are beneficial for you. It all depends on the staging. It all depends on the Gleason. The alternative treatments are a very good way to start. And if you were to come here, we can also guide you for the next steps.
It's important, let's say, if you are, to be more specific, if you have a Gleason 6 and you're in stage 1, most likely you don't need any therapy and you will survive this. If you have 7, 8, probably if you're very young, thinking about robotic surgery would be a good idea. If it's 8 or 9 or 10, I would strongly recommend that you have surgery because it has the highest possibility of cure. And thank God with robotic surgery now, the complications of impotency and ¿cómo se dice cuando se orinan? Incontinency and impotency are now very, very low. With the old type of therapy that were so high that I was not comfortable in talking about surgery. But nowadays with the robotic surgeries, the results are much, much better. So again, as Dr. Julio said, it will depend on the Gleason. Talking about early stage or stage 1, where the surgery can be a curative procedure. If it's stage 3, then forget about the surgery. It's of no value to you, and our therapy can be much more effective. So stage 1, high Gleason scores, surgery, low Gleason scores, our therapy would be more than enough.
Perfect, perfect, perfect. Thank you so much, Gabriela. Great question. We have a question from Anonymous. I have one positive on one side and one negative on the other side of my breast. Will this be conflicting each other in treatment selection for me?
So I'm assuming that you say positive for hormone dependency.
Receptors.
No, our treatment will be very, very effective for both.
Perfect. Are the therapies performed by technicians or by nurses or by doctors at your center?
It will depend on which therapy. So for instance, the immunotherapy is administered by very specialized personnel from our institution, and they are technicians. Most of the therapies are applied by our nurses, which are specialized in this area, and are supervised by us, by the doctors. So we don't have any therapy that requires a doctor to give the therapy. Well, I'm sorry. Dr. Julio is the one that gives the hyperthermia. So in that case, yes, a doctor is involved in the treatment. Of course, we have technicians that will help you get in and out of the cocoon where the hyperthermia is given. But in that case, a doctor is providing or administering the treatment.
Perfect, perfect. All right, moving along. Keep the questions coming, guys. Okay, John, it's a very long question. Okay, my wife has a serious carcinoma with a huge cyst in her belly. She has undergone 3 immunotherapy treatments, which have helped her a great deal and have considerably reduced the size of the lesion in her belly. However, as the cancer was very advanced, the cyst remained very large, 28 by 18 centimeters. We decided to have the catheter installed in the cyst and treat her with sodium bicarbonate. It's working and the cyst is shrinking. She's not losing any more blood, and every day we remove fibrous clumps from the disintegrating cyst. She is currently still undergoing treatment with sodium bicarbonate. I understand that these are very different techniques, but would hyperthermia be more appropriate to reduce the size of the cyst, or is it better to continue the sodium bicarbonate treatment until the cyst is considerably reduced?
Well, I'm very surprised and happy that the sodium bicarbonate is helping directly. But I mean, it's a treatment that is well proven. In Italy, they're doing quite a bit of intratumoral treatments with sodium bicarbonate. It's usually applied through an artery directly. The direct injection to cysts is a little bit dangerous because the cyst can burst and then more cells can be dispersed. But as long as the tumor is reducing in size, I would continue with that therapy. And hyperthermia can be a very good adjuvant to that therapy. So if the tumor is reducing, continue with that therapy.
Perfect, perfect. And let's see. Okay. Oh, Tony, thank you. You sent me your address. I appreciate that. And Lisa, remember me too for that signed book. Of course, Lisa, send me your address. I'll write it down and send you guys a free copy, signed and everything. We're gonna go with
Can't survive.
Jacob. We understand that cancer cells cannot survive high temperatures that normal cells can easily tolerate. But how about extreme cold? Are there any proven anti-cancer benefits to cold plunges or similar treatments?
Well, there's some cold therapies, cryoablation, that are localized, cold in tumor, which can reduce tumors up to 5 centimeters. Cold plunges or similar treatments have limited results against cancer. They do have similar beneficial effects as a sauna, but it's not going to have a direct effect against cancer. The only modality of cold that I know about so far is a cryoablation.
All right.
Perfect. Anything to add, Dr. Contreras?
No.
Perfect. Paola, after full mastectomy, my triple positive breast cancer has metastasized onto the skin, and I have open wounds in both breasts, lung, pleural fluid accumulating, and I wonder if I could be a candidate with all these physical symptoms.
Yes, I think that you would be a very good candidate. Send us all your reports, some pictures, and we'll let you know if we can help you or not. But we've had many patients with similar cases like you with very, very good results.
We actually have one right now.
Yes.
So you have a chance.
Good, about 30% of our patients are breast cancer around there, right? We have,
I would say
yes.
Yeah, so
40,
30,
Probably
40,
40, yeah.
40.
30, 40, and yeah, so we have a lot of experience with breast cancer, positive, negative, HER2 negatives, and everything like that. So, Paula, call us. We have admissions people on the phone right now. If you have any questions, we'll be happy to schedule a free consultation with one of our doctors. We just need some medical records so we can base a recommendation from something. All right. Anonymous. Dr. Contreras and team, I am no patient, but I have lost many friends and families to this. So I'm a loyal student who praises your medical ethics and healing patterns. Thank you. Thank you.
Thank you very much.
We appreciate that. Okay, if I apply coming to your center for treatments, will you, Dr. Contreras, review my medical records before my treatment plan is made, or could it be another doctor to review my records?
Generally, I personally review every case that is sent to us, and I will contact my team, and in many cases, we will have a consensus of what we can do. But generally, I personally review all the cases.
Yes, and our admissions doctor, he can do a Zoom call with patients and family to explain the recommendation to Dr. Contreras, and back and forth questions and answers. So we're very open and very available for that. But Dr. Contreras reviews all patients before being admitted, and he does all the recommendations. Thank you for that question. And can I shake Dr. Contreras' hand and give him a hug when I come to Oasis? Such a great man. Thank you for everything you do.
Thank you.
It says anonymous, so we don't know who to thank, but thank you so much.
But we must know you.
Yes, we're Mexican, so we hug a lot here at the hospital. And John, thank you. You're welcome, John. If you have any questions, please give us a call. John Fittement. I emailed you my address for my free book. Here you go again. Got it. Thank you so much. Okay, Catherine, my breast cancer metastasized to the scalp, not the skull. Oh, I think this was from a previous, to the scalp.
So it is the scalp.
My oncologist told me I probably won't survive. I would also like a copy of Dr. Contreras' book. Send us your address.
There is no reason why you shouldn't be able to survive. And if that's the only area to the scalp, then you should have good possibilities, okay?
Catherine, give us a call, send us an email, fill out one of our contact forms. We can definitely help you, Catherine. So don't lose hope. And there's always a second opinion and a way to survive. So feel free to contact us. Now here are all the addresses. Now I gotta write all of them. So many of them. Okay, Veronica, we have just a couple questions left. Because the hour's gone flying by. Thank you so much, Dr. Contreras and
Yes.
Dr. Julio. This has been a very, very interesting and very informative. Veronica, breast cancer metastasis to bone T11, L5, S1, S2, several lesions found in liver. PET scan to be done next week. If positive, they want to do a biopsy. Then if cancer, can hyperthermia be effective on the liver?
Yes, yes, our treatment has been very effective. I would urge you to, again, revise and review our website, look at our stats in breast carcinomas of your type. I'm not sure if you are virgin to treatment or not. That means that whether you already started a therapy or had therapy before, or this was just diagnosed. But if you come here as your first resort, our 5-year survival rate is close to 75% in comparison to about 16 to 20% with conventional therapy.
Yeah, I think that they're gonna do a PET CT.
They're going to do a PET
for
CT.
the liver.
So
Liver,
There's
yeah.
a
well,
study
it will show everything.
Yeah.
What I'm saying is that it's very likely that Veronica was just diagnosed.
Diagnosed. Okay. Yeah. Send us your PET CT, Veronica, and we'll be happy to take a
review
look,
your
to
case
review
and
your
give
case.
you our recommendation.
So much. Lisa, 2022 DCIS in left breast. Got second opinion from you guys, and consensus was mastectomy. I appreciated your honesty. Had a mastectomy in 2022 this year, and I got tumor on the right side of a completely different type. So did another mastectomy followed by Taxol Herceptin regimen weekly for 12 weeks. Now doing just Herceptin every 3rd week till next May and taking the daily tamoxifen pills. Is this a good path for now?
Yes, it's a very good path for you, and I wouldn't change anything. I think it's the correct treatment. Again, if you want to be proactive and do something, you're doing everything against the tumor, which is very good. With our therapy, you would be doing something also for you that could probably give you a better result. But the therapy that you're doing now should be sufficient.
Perfect. Thank you. Are there any drug-free treatments that can make hyperthermia inadvisable?
Yes and no.
Yes and no.
One of the limitations of hyperthermia, it's a current or impending blood coagulation complication, a thrombosis. So if you're a patient taking a blood thinner and you had a history of thrombosis, you're not a good candidate for hyperthermia. So that's something that we take into consideration. There are some chemotherapy agents which are photosensitizing, so the hyperthermia might not be ideal for you. But other than that, there's nothing else that can make the hyperthermia unadvisable.
Perfect. Okay, last 2 questions, guys. If you have any more, we can take 1 or 2 more, but we'll take this one. Do you use low dosage chemo with immunotherapy to improve it? Great question. We do.
Yes, there's 2 types, okay? The first one is cyclophosphamide in very low dosages. And cyclophosphamide reduces the amount of T-regulating cells. So in other words, we deregulate the immune system with this therapy. We use it in insulin potentiated therapy before the vaccine so that the vaccine works better. And then after the vaccine, orally in a very low dose so that the immune stimulation will be greater, okay? And then we also combine it with anti-tumor therapies like capecitabine after the vaccination. We want to wait at least 2 weeks or 3 weeks after the last vaccine to start the low-dose chemotherapy. But yes, it's a combination of chemo, low-dose chemo, and immunotherapy that has proven to be very effective.
Perfect. We're gonna do some shout outs. Thank you guys for sending us all your addresses. I really do appreciate that. I'm gonna write every one of them down and send them to you. Lisa, Linda Brown, hugging Dr. Contreras is healing in itself. I like that.
Love it.
Emil, I'm very encouraged and thankful for your help from Oasis of Hope and looking forward to going back in the beginning of December. Emil, thank you so much.
We'll see you here.
We'll see you here in December. You're gonna be one of our December patients. You're gonna get lots of gifts. Catherine, thank you for your webinar. I would also love a copy of your book. You send me the address, Catherine, I'll get that to you. Lisa, thank you so much. Troy, cancer sucks, but we're on this together. Prayer and positivity is a game changer. Also, listening to Dr. Contreras is such a good thing. Isaiah 41:10. Thank you, Oasis. Thank you, Troy.
Amen.
Thank you. God bless you. Lori, I'm actually a breast cancer patient, stage 4 plurimetastatic liver, bone, lungs, lymph nodes, and I have spectacular results with the support of Dr. Contreras and Dr. Julio.
Amen.
I owe them my life. They are very good, and I am here to continue my learning journey, and also because I am a big fan.
Merci, Lori.
Thank you, Lori. I appreciate that.
Amen to that. So praise God for your result.
All right, all right. We're gonna do a couple more questions. It's 5:05. Dr. Contreras, can you do 2 more questions?
Well, let's do 2 more.
And one for Dr. Julio. Okay.
1 and 1.
Any home program continuation after the treatment protocol done at your center? I'll let Dr. Julio.
That's what I speak
That's his
about
specialty.
every Friday. Yes, there is a very thorough home protocol for you back home. Basically, what we do here, it's half the protocol, and the other half, it's gonna be performed back home. In your house, you're gonna do a combination of antioxidant therapies. You're gonna do the low dose chemotherapy agents or metronomic chemotherapy, as we call it here. You're gonna do a lot of supplements that are gonna improve your quality of life. We're also gonna give you the future of medicine, which is liposomal medications. And that's gonna be helping cover all the aspects of cancer. This is a holistic treatment. So yeah, you're gonna have a home protocol back home.
Perfect, perfect. Great thing about Oasis is that we give, we're very Christian-oriented hospital, and we do devotionals every day. You eat here, you sleep here, we hug you, we love you. We have talks, lectures every day. Dr.
You make
Contreras gets one,
friends.
Dr. Julio, there's about 20 patients at the hospital at any given time, and there's a lot of cancer wisdom running through the halls, and friends are made, and information is exchanged. So Oasis is a complete program. We have cooking staff, we have cooking classes, we have support psychologists on staff, we have a pastor on staff. So it's very unique place to get treatment, and recommend you contact us if you have any questions. And okay, last question. When you say the average stay is 2 to 3 weeks, do you cure cancer in that time, or give patients things that they can do at home to continue treatment?
Yes. It's the initiation of a therapy, and depending on the results and the evaluations that we'll do at 3 months, will determine, how to follow you up. But yes, as Dr. Julio said, the therapy that you do here is what's called oxidative therapy. When you go home, it's antioxidating therapy, and it's a combination of these two that has given us the best results. If a patient is cured in 3 weeks, we praise God for that, because we're good, but not that good. It takes time to help cancer patients, especially when they've been treated with radiation, chemotherapy, surgeries.
It took time to appear, and it's gonna take time
to disappear. Very good.
Okay, last question, guys. And again, I thank you for joining us. It's very special for us to do this, and very special to us to have such a big base of people that attend our webinar. So Maria Morris, what are your results with inflammatory breast cancer? I haven't started any treatments.
Okay, inflammatory cancers of the breast are one of the most aggressive, and our treatment has been a lot more effective than chemotherapy, which has proven not to be effective in inflammatory cancer. Sometimes we will do combinations, especially if there's an open wound because of the inflammatory process. But yes, we have been very effective against inflammatory cancer of the breast.
Okay, thank you so much for attending our latest webinar. We will have another webinar in about 2 weeks. We will send you all an email, an invitation, so you can join us. And just so quickly, Lisa Rabb, this is true. He prayed with us after we've had our second opinion from him. So that's great to hear. Once again, if you have any questions, please feel free to contact us at 888-500-4673. That's 888-500-4673. We have admissions coordinators that can take your call and answer your questions, walk you through the process of what it's like to be a patient here at Oasis of Hope. Dr. Contreras is the medical director here who oversees the entire operation. Everyone's his patient, but doctors like Julio, who specialize in hyperthermia and ozone, are the attending physicians. So we are located in Tijuana, Mexico, right next to the beach, very touristy area. And the great thing about coming to Tijuana for treatment is you can fly into San Diego. You don't have to fly into Mexico. So once again, thank you so much for attending our latest webinar, and have an amazing day from Tijuana to the whole world. We send our love.
Thank you very much.
Thank you.
Thank you, Dr. Julio.
Dr. Julio, Dr. Perez.